So hello, my name is Michel Delforge. I'm a hematologist working at the University of Leuven in Belgium. It's a privilege to discuss with you the results from the quality of life data from KarMMa-3. So KarMMa-3 is a first prospective randomized trial that compared the efficacy of the BCMA targeting CAR T-cell product ide-cel with standard of care regimens. And basically it was the first trial to assess this concept. Of course, there was the publication earlier this year on the efficacy results where ide-cel showed clearly superior progression-free survival in patients with 2 to 4 prior lines of therapy and who were triple class exposed. That's excellent news, but of course, we want to know how does this benefit in PFS translate in quality of life for patients. And that was exactly the topic of this sub-study. So what did we do? Well, we looked at health-related quality of life with standard tools like the EORTC QLQ-C30, the myeloma module from the EORTC QLQ, and also we looked at RRMM. And so the major findings from this sub-study were that first of all, there was a very good completion rate for PRO assessment, which was in more than 75% of the patients, and it was also maintained over the observation period, which extended 2 years. And then what we found was that with ide-cel there was an initial drop in global health status. But that was not a surprise because unfortunately patients were not allowed to get any new bridging therapy while the CAR T-cells were manufactured. But once they received ide-cel, there was a very rapid and steep increase in their global health status. And this was not only statistically significant, but it also exceeded the threshold for a minimally important difference. We saw also these clinically meaningful and statistically significant improvements in functioning scores like physical functioning, cognitive functioning. We saw a decrease in disease-related symptoms like fatigue and pain. And overall, this improvement in quality of life was also faster compared to the control arm. And in the control arm, there was more or less stabilization of quality of life, and in many domains, even a worsening. So, in conclusion, we believe that these observations are very important because in addition to clinical efficacy in terms of progression-free survival, depth of response, we also see that this response comes with a significant and meaningful improvement in quality of life for patients. And it is of such a big importance because we do know that patients with triple class exposed relapsed refractory myeloma, they have a poor quality of life, they have a heavy symptomatic burden. And by a single infusion of ide-cel, we can not only prolong their expectations, but also do this with increasing their quality of life. Thank you for your attention.